Hey guys, my name's Dan. I'm one of the physical therapists here with Vive Health. And today what we're going to do is talk a little bit about knee osteoarthritis. What is it? What are some of the cardinal signs that we look for when diagnosing it? And what can we ultimately do to get you feeling a little bit better? So knee osteoarthritis refers to the breakdown in bone and cartilage in the knee over time. To some extent, this is the normal process of aging. We're going to get some wrinkles on the outside as we age. We're going to get some graying of the hair. We're going to get some changes on the inside too. However, excessive wearing down of the bones and cartilage can lead to pain, stiffness, loss of mobility, and ultimately dysfunction. So some of the cardinal signs, some of the things that we look for when diagnosing knee osteoarthritis include a gradual onset and progressive onset of pain. So this isn't something that comes on out of the blue or something that happens with the mechanism of injury. This typically is something that's going to be gradual in manner. Additionally, we're going to see the pain increase kind of at those end ranges of motion. So when we're bending our knees deeply to get something out of the bottom of the kitchen cupboard, or if we are extending our knees kind of going down the stairs or off a curb. Additionally, what we're going to see is pain after those long periods of immobility or disuse, such as the first couple steps in the morning, or if we've been sitting for a little bit too long at the office chair and we go to get up, our knees are typically going to be a little achy and stiff at that point. So now let's talk a little bit about the anatomy of the knee. So we have four major bones that compose the knee joint. So we have the thigh bone or the femur, we have the fibula on the outside, we have the tibia on the inside, and then we have the patella, which is the kneecap, which sits on top of them all. So when we're talking about the knee, we can talk about three major compartments. So the femur and the tibia kind of articulate like this. In between those two is the meniscus. So two of the compartments kind of are between the tibia and the femur. We have the lateral compartment of the knee and the medial compartment of the knee on the inside. Additionally, we have a third compartment, which is underneath that patella. So now that we know a little bit about the anatomy of the knee, let's talk about how we diagnose it. So if you go to see a physical therapist, they're going to take you through some special tests and they're going to watch you move functionally. They're going to use that information to determine where the cause of your knee pain is and whether or not it is osteoarthritis. We can, of course, use imaging. The imaging that typically is done for knee osteoarthritis would be an X-ray. However, if your symptoms are pretty new to you, or if the volatility or the severity of your symptoms is pretty low, that's not always the necessary first step. In fact, we see that 20 to 40% of people over the age of 40 with no knee pain at all have knee osteoarthritis show up on imaging. Therefore, it's not always the best test for determining, is osteoarthritis the cause of your knee pain? So if you're still watching this video and we think that you still have knee osteoarthritis, what can we do about it? The fortunate thing is there are so many things that you can do from a conservative rehab standpoint to help your symptoms and to help your function. Exercise, when done correctly, is one of the best things you can do to help manage your knee pain and improve your movement. We're going to focus on restoring that normal range of motion and improving the capacity and strength of the muscles around the knee joint. If we get those muscles stronger around the knee, it's going to take the pressure off the joint itself. For a little while, it's probably best to avoid those high impact activities such as running and jumping. Eventually, when the symptom volatility decreases, if it's within your goals, you can kind of look to reinitiating those. Additionally, if weight seems to be an issue for you, this would probably be a good time to start that weight loss journey. Losing a couple pounds can take some pressure off of the joints. There are, of course, some other modalities that you can use to kind of reduce your symptoms if you're in a period of high symptom volatility, or if you're looking just for a little bit extra to help manage your condition. These things would include a ice pack or a knee compression sleeve to help reduce that swelling. So if all of that sounds right to you and you're ready to kind of take the next steps, go ahead and navigate through the Vive Health app and follow along with the regimens. We're going to break down a couple exercises that you can start today to help kind of get back on your feet and kind of start that journey to decrease knee osteoarthritis.